Today we'll learn about interaction of X-ray with matter. Earlier we read about Bremsstrahlung and characteristic radiation from which X-rays were produced. Today we'll see that after the production of X-rays, what happens means when they will interact with the matter, the patients or other substance, what interactions will happen, will be dealt. Interaction of X-rays with matter. There are 5 ways: coherent scattering, photoelectric effect, Compton scattering, pair production, and photo disintegration. The last two, pair production and photo disintegration, are not used in diagnostic radiology. What does this mean, that interaction of X-rays with matter? This means that when the X-rays is produced from the anode side, when it goes and hits the patient, that is the interaction of X-rays with matter. That means what all can happen after the X-ray will hit the patient and how it will affect, that is the interaction of X-rays with. First one is coherent scattering. It is responsible for scattering of the X-rays. Two types, Thomson or Rayleigh. Thomson means only single electron is involved. Rayleigh means all electrons will be involved. Now, what is this characteristic of coherent scattering? That means there will be no change in wavelength, no ionization, no energy transfer. Then what will happen? Only change in direction of radiation. Therefore, it is a scattered radiation. Now let's draw atom. Radiation has appeared, X-ray radiation. It hits the atom. What will happen? Only vibration of the atom will be there. Therefore, we are drawing the vibration is produced in the atom. And what will happen? The radiation will change the direction and only atom has been vibrated. Therefore, there is only change in direction and scattering of the radiation is produced. This is known as coherent scattering. Now let us study second interaction, photoelectric effect. It is used for absorption. That means the X-rays incident interaction will be absorbed. What happens? The incident photon will interact with the causal electron. This will eject the causal electron from its orbit. Now what will happen? This ejected electron is free and it will move out, and this is moved out as photoelectron. Now there is a space or vacancy in the causal. This will be filled out by outer shell electron. As electron will move from the L shell to the causal, it will give energy. This is known as a characteristic radiation. Now let us draw the diagram. First we'll draw the atom, the electrons, and in the red we'll draw the incident X-rays which are coming. Ejected the electron, known as photoelectron. What will happen? From L shell it will go down to the K shell. Energy will be released. This is known as a characteristic radiation. The vacancy is replaced by L shell. It will come down and there will be a vacancy. Therefore, this characteristic radiation and photoelectron which are there, they are harmful. Now let us study some important note about photoelectric effect to happen. First, the incident photon or the X-rays energy which is coming, it should be greater than the binding energy of the electron in the causal. Suppose the binding energy is 50 kilowatt. Therefore, if the incident photon energy is 20 kilowatt, nothing will happen. But if it is 55, then it's a yes. Second point to note is the photoelectric effect is inversely proportional to the cube of the energy. Therefore, more the energy, lesser the photoelectric effect. Example, again same binding energy of electron in the causal is 50 kilowatt. Therefore, if the incident 55, then it will happen as compared to 100 kilowatt, because more energy, lesser effect. Third is that photoelectric effect is directly proportional to the cube of the atomic number. let's study the advantage and disadvantage of photoelectric effect. Now, what is the advantage? Good quality of the image because it enhances the natural tissue contrast and no scatter radiation. Disadvantage that the patient will receive more radiation because those were harmful photoelectron and they were harmful. Therefore, we have to minimize it by using high KVP technique. Now let's study the second effect, which is Compton scattering. What will happen? The incident photon will come. It will strike the outer shell electron. What will happen? The incident photon will be reflected in a new direction, which is known as a scatter radiation. Electron will be ejected, which is known as a recoil. Therefore, disadvantage scattering, and because of scattering, film forget, and these are harmful. Therefore, radiation hazard will be present. Now let us see the diagram. We'll first draw the atom. Red color, the incident energy has come. It has turned the outer shell, ejected in the new direction, scatter radiation. The electron has been removed, recoil electron. Now the new atom which is produced as a result, there is a vacancy in the outer shell because it has been ejected. This and the new radiation is in new direction. Therefore, it is a scattered radiation, and this scattering is known as a Compton. Now let us see the difference between photoelectric effect and Compton scattering. Photoelectric effect is for absorption and Compton scattering name suggests scattering. Photoelectric effect is inversely proportional to the cube of the energy, whereas Compton scattering is inversely proportional to energy. Photoelectric effect is directly proportional to the cube of atomic number, whereas Compton scattering is independent of the atomic number. Photoelectric effect has effect on the inner shell, K shell, whereas Compton scattering is outer shell. There is good image quality in photoelectric effect, whereas in Compton scattering, due to scattering, there is decreased image quality. Photoelectric effect can be harmful to the patient, whereas scattered radiation, therefore harmful to the patient. These are the difference between photoelectric effect and Compton scattering.